Well, thank you so much for being here, Carrie. Carrie or Caroline?
Either's fine. Caroline.
Okay. Caroline. Okay. Well, could you state your name and title and organization, please?
My name is Caroline Hunt, and I am a CRNA, which is a Certified Registered Nurse Anesthetist. And my organization would be the AANA.
The AANA. What does that stand for?
The American Association of Nurse Anesthetists.
Okay. Very cool. So we were just discussing pre-recording that you didn't even know that this job existed until not long before you applied for the program, right? So if you could briefly describe what led you to your current job and any details that would help us understand where it got you there.
So before I did the anesthesia school, the program, I was a registered nurse, worked in the ICU at UAMS, did some travel nursing, and it was amazing, and worked in the ICU and the ER, but still knew I wanted to go back to school. I wanted some sort of further education. So your options with nursing are endless. I could be an NP, a nurse practitioner, or I could have gone back and to be a PA, physician's assistant, but I knew I wanted a little more autonomy. And my friend that I was travel nursing with was applying to CRNA school, and I didn't know what that was, and she told me, and did some shadowing at a hospital, and it was eye-opening. So I put people to sleep and wake them up, and it's very, very challenging, but also very fun. So that is how I applied, and I definitely would recommend nursing for more than a few years before you apply.
Okay. So this was further into your career, not straight out of high school did you go and become this. So what drew you to nursing to start with, though?
I just liked healthcare in general. I actually originally wanted to be a dietitian, and then my roommate in college was applying to nursing school, knew she wanted to be a nurse her entire life, so I took the intro to nursing class, and that was it. And changed my major.
It hooked you. Okay. Let's see. What education, training, or experience did you have to attain your current job? And then maybe a little bit more on why you think they should have a few years of nursing under their belt, maybe even if it's not a requirement too.
So you have to have your bachelor's of science in nursing, and all schools require at minimum a year of ICU experience. I would say some actually require you to have two. And I would encourage you to have at least a minimum of 2 years, because it will give you a solid understanding of all the things that go into anesthesia. So more medicines, vital signs, disease processes. There's so much that experience and seeing patients and codes and how to manage people on ventilators and different situations that will definitely help you in your anesthesia career.
Okay, all of that makes a lot of sense to me. Could you help us understand what your role is in the process of putting someone to sleep and what you think are the skills required for your position? So soft skills and hard skills.
So I'm the person that comes to see you in pre-op, and I interview and I ask you all your medical history. What medicines do you take? If you've had surgeries, I want to look at your teeth, and I want you to open your mouth. I want to see if you're going to be a difficult airway. If we put in a breathing tube to help you breathe while you're asleep for surgery. There's different kind of airways, and so we'll evaluate that. And then we put you to sleep with medicines, kind of like nitrous at the dentist, but ask you all about your health history, and then we'll go to the operating room. You'll go to sleep through your IV. We put in that airway, and I monitor you while you're asleep. So I watch your vital signs, and I work with the surgeon and make sure that you're relaxed if you need to be, you're moved, and help with the other nursing staff. And then I wake you up and shut off the gases and give you different medicines. I don't know how detailed to be. It's
No, that's super interesting. So what do you think makes you successful at your job? What skills do you have that make you successful at that?
I would say every anesthesia provider I've ever met is a very type A personality. And if that doesn't come out, I wouldn't have considered myself type A in high school or even as a nurse, but it definitely came out in anesthesia school for some reason. So task-oriented, I'd say we're all a little organized, and a passion for learning in its own sense. Medicine is always changing. This is not like history where it's done and you're good. medicine is there's always something new being developed, a new instrument, a new tool, a new kind of medication, new surgeries, better ways to do things. It's always interesting. So it's never boring. It's never stagnant.
Okay, off my list of questions, but what does your continuing education look like then as things are ever changing? Do you have to seek that out, or is there specific ways to keep yourself up to date with all of that?
So most of it is every 4 years, we have to have so many years of education, so many hours of education. Some people, if you go back to school, that of course counts. Certifications like your basic life support, but we have to have advanced cardiac life support and pediatric life support. Things like that will count towards your education. But in general, there are continuing education just like teachers have to do. We have to learn something new because there's new drugs. So they'll send out information packets and we can read that. We can go to classes. There's all kinds of events every year and cool locations. So I can go to Mexico and do my continuing education, and it would be a business expense. I can go to different classes and learn about regional anesthetic, which is kind of like the blocks at the dentist that make your mouth numb. Well, we can make your arms numb, your legs numb, just like epidurals for having a baby. There's always new techniques and new ways to do that. So there are classes, and that counts as continuing education.
Okay, all right, that's a very broad picture. Thank you. Let's see. What does an average day look like for you? Start of the day, end of the day. What are you doing all day?
So it depends. Just like in, I don't know, this is hard to explain. So there are different places to do anesthesia. So I work full-time at a women's hospital. And so I do epidurals all day. I do emergency C-sections. And I pick up extra because I work 7 days a month. And then I pick up at a surgery center. So my surgery center is more like what you'd consider anesthesia. I get there at 6:30, and I sit at my room. I go see my patient, and that takes about 15 minutes to interview them, make sure that they have all the medicines that they need. I put orders in, tell the nurses what they need to give that patient, and then we'll go to the operating room. I'll put them to sleep, and the nurses and the scrub techs and the surgeon will come in and do their part. And then when the surgeon's done, I wake them up, go to recovery room, and do it all again. Go see my next patient. Usually get off work around 3 to 5 when everyone's awake and out of the hospital.
Okay. So how many patients do you have in a day usually?
So the one place I work is a plastic surgery center. So usually around 2 to 3. Some places I work, like an ortho, which is doing like broken bones and bone spurs and foot surgery and hand surgery. I may have up to 10 patients a day.
Oh, wow. What would you say is the best part of your job?
Everyone is always happy to see anesthesia. So we're an important part of that. So it's funny for the laboring mothers because they are so angry and hurting, and then within 10 minutes of us being in there, they're happy, they feel good, they're laughing, they're ready to meet their baby. And I think we take some of the anxiety out of surgery for regular surgeries. A lot of people are not afraid of the surgery itself. They're afraid of going to sleep. It's an unknown thing to them. And
right.
To us, it's just science. So we get to take out that unknown portion for them and give them some relief before they go to sleep and wake back up.
I love that. So it's really patient-centered for you, like the experience of making someone's experience better. Very cool. What do you find as the most challenging part of the job?
That every patient is different. You may put a perfectly healthy person who doesn't see a doctor for anything, absolutely nothing wrong with them, and they go to sleep and then their heart stops for no reason, and you have to figure out why. Like, that's on you. So that's, you troubleshoot. You go through a list of things that could be wrong. You give medicines. You're the one who runs the code. Anesthesia will run the code in the operating room. So there's a lot of pressure on you, but it's in a fun, stimulating kind of way. Like, it's a passion. Medicine is a passion.
Yeah, that's heavy. That's a lot of pressure, like you said. But yeah, it sounds super rewarding.
Every day. It's very humbling too.
Humbling, okay. So what are your long-term career goals? It sounds like you're in an incredible career, but do you have any aspirations outside of this? Anything that you want to try in the future?
So they are phasing out, like right now I have my master's degree, and I was one of the last classes to go through that can get their master's degree. Right now, if you wanted to be a nurse anesthetist, you have to actually get your doctorate. So we will all be doctorate prepared. So that is in my long-term goal, is to get my doctorate, which will be another 2 years for me. And I might even pair it and go back to school with an FNP. So I would be a nurse anesthetist and a family nurse practitioner.
Wow. Okay. And what draws you to that? What would a day look like, or what would your career look like if you had both of those things?
So if I was also a nurse practitioner, it would, for one, be continuing education in its own right. I mean, disease processes are always changing and it's always updating, so it would refresh my education and teach me new things. A nurse anesthetist is a very specialized type of an APRN. So I'm an advanced practice nurse practitioner already, but I'm not a family nurse practitioner or an acute care. And if I were to go back for one of those degrees, I could pick up as a hospitalist in a hospital, manage patients in a different way. It would just help make me be a more well-rounded practitioner.
Very cool. I love that. Okay, so for everything I'm getting from you, it sounds like you really enjoy what you do. What advice would you give to students who are seeking a career that they're passionate about, that they enjoy, that they want to get up every day for?
I would encourage them to, if this is something that interests them even remotely, to seek out a shadow opportunity. And they're out there. I don't know of anyone who wouldn't want to have someone shadow them. You could spend a day in the operating room. It's a few minutes of paperwork, and then you could be in there and watch us put someone to sleep. You can watch the surgeries if that doesn't gross you out. It's a very eye-opening experience, and was very glad I did so. And if medicine is something they want to do, they can shadow the surgeons while they're in there. They can shadow the nurses. So you could, the scrub techs, which help with the surgery and do a lot more than what I think a layperson thinks. They're the ones who actually sew you up after surgery, not always the surgeon. There is a lot in the OR as far as careers that just shadowing a nurse anesthetist, you'd be able to see.
Okay, that's great advice. Do you have any advice for someone preparing for an interview? I would assume you've had to do quite a bit of that in your career. So what advice could you give them? There's probably lots of areas you could focus on, but what would your biggest piece of advice be?
And this is a broad question. An interview for what exactly? For shadowing? For a job?
That's a great question. Just pick one and tell us which one it is.
For shadowing, if you wanted to speak to somebody, I would encourage you to have a why you want to, that reason why written out. And I would do some soul searching and make sure that it is something you want to do. And it can be simple. You don't have to make that complicated, but do you have a passion for healthcare, or are you just curious? Even if it's something that's as simple as that, I don't know what I want to be, so I want to shadow you. We would all take you in and encourage you to open your eyes and see what's out there. I would encourage you to Google it, YouTube it. Find something that you think is interesting and look that up, and then ask questions about that one thing. Just conversation starters.
Right, so that kind of preparation, don't just show up with no knowledge at all. Try to have the conversation starters and questions. Okay, great advice. Let's see. You've shared a little bit about this, but what's the job outlook for this occupation?
Well, as far as job security goes, it is pretty solid. You can't go to sleep without us, so we're an important part of healthcare. Job outlook is great. There are a million places to work. I can work in a dentist office and put you to sleep for wisdom teeth. I can work at a women's clinic and do epidurals for having babies. I can work in a surgery center, outpatient surgeries, like getting your gallbladder removed, or in a hospital, like doing open heart surgeries. I've done that. Like, there are so many settings. So whatever your passion is, there's an anesthesia need out there. We do our own clinics as far as for depression and anxiety, ketamine clinics, IV infusions if you get dehydrated or you just need a little pick-me-up and you need some vitamins, or if you run a race and you need to be rehydrated. Anesthesia is everywhere. There are lots of things that you can make your passion within this career.
That's great. That's awesome. So again, we talked about job shadowing, but for the organizations that you work for specifically, or are there any opportunities for internships, paid or unpaid, job shadowing, like you mentioned, or mentorship?
So job shadowing, those opportunities are endless, I think. Internships, no. And there's nothing paid. Like, anesthesia school was actually, you have to take out loans or have another way to pay for it. You're not allowed to work while you're in anesthesia school. They used to pay you for this, but they don't anymore. That's not a thing. So that can be daunting, but it's very doable.
Oh, wow. Okay. That's good to know. And mentorship with you specifically, if there was a student that was super passionate about this or really excited and wanted to start this journey, would that be something that you'd be willing to do?
Absolutely.
Great. Well, thank you. Well, those are all of my questions that I had written down, but is there anything additional that you can think of that you'd want to share with a student that might be interested in this?
So I think if you have a passion for being your own boss, that's definitely something that you can do too. I think that was something that didn't actually get put across to us in nursing school. So like, I'm technically an employee of my own business, and that's something that you get to learn. So business schools, it's not just nursing, and it's more than medicine. You get to learn how to manage an employee, and taxes are different, and I don't know how to explain it in a small amount of time.
Are you like contracted with them is that what you're saying? You're contracted with this organization?
My business, yeah. So I'll be an independent contractor, and I've worked as an employee for a hospital before, but prefer not to.
That's fair, and I think that's a great point. I'm glad you brought it up, that there are multiple ways to go about this. What could you share a little bit about why you prefer contract employment? Because I don't think a lot of students know that really think about a lot of professions in that regard, or that you can do that and be your own boss. But why do you prefer it?
So there's two reasons. First, I get to make my own schedule. I can, at a surgery center, or someone will ask me, hey, can you work this day? And I can say no. So I can work as much or as little as I want to, as much or as little as I need to. I didn't know that was the thing. For nurses, it's not, so it's definitely something that's more of an advanced practice thing. There's no learning the difference between W-2 and 1099. Like filing your taxes. You work for somebody, they pay half of your taxes, and you pay half. When you're 1099 and an independent contractor, you get to pay all those taxes. But it also means that you get to make more money. So that was probably my favorite two parts. I get to make my own schedule. I can work whenever I want to, wherever I want to, and I can make more money by doing so.
Makes sense to me. Yeah. Okay. Well, those are all the questions I have. And thank you for that extra piece of advice. That's really good stuff. Thank you so much. That's all I have for today.
Absolutely. Thank you.
Okay. Talk to you soon.
Bye.
Bye.